So let's get started. First thing, I just want to go around and have you guys introduce yourself so we know who's here. Just tell us your name, where you're living or where you're from, and what school you go to and why you chose to attend this event. So I'm just gonna call on you in order. So Crystal, do you want to go first?
Sure. Can you hear me all right?
Yeah.
Okay, so my name is Crystal and I'm from Wisconsin. I graduated 5 years ago with my bachelor's, and I just applied to medical school this year, so hope I get in. If not, like, I'll just try again next year. But so far so good. And I live abroad right now. I live in Taiwan. I love it. I'm just trying to get some world experience, and then I'm planning on moving back to the US as soon as everything settles down with the coronavirus. And I hope at least I can be back by July, hopefully, to start school. But I think I'm here because I think ethics is really, really interesting. There's so much that goes into every decision. And then interestingly, recently in Taiwan, there was a case of a guy who was in a coma for 30 years, and then he finally just passed away. So everyone's wondering, oh, should we have done something sooner? Like, how does he feel? And please forgive my ignorance, but I'm just like really interested in everything. So I don't know too much. So I did read the article, but a lot of it kind of went over my head, but I'm really interested to share where I can. But either way, I just really want to learn a lot.
Absolutely. Thank you so much for that introduction. We're here to learn. Everybody here, I'm pretty sure that article was kind of complicated. Trust me, I didn't get 100% of it either. But we're going to discuss it, and we're going to see what we can learn from each other. But thank you so much for that introduction. Shreya, would you like to go next?
Yeah, I'm a high schooler in Charlotte, and I wanted to do this seminar because I've just always been really interested in like neurology and psychology and like things related to the brain. And then ethics is also just like interesting to me, like how people think about it.
Absolutely, absolutely. Where do you go to school in Charlotte? Because I went to
Cal.
Oh my God, really?
Yeah.
No. That's so cool. Okay, thank you for that introduction. Who do we have? Cassandra, do you want to go? Am I saying your name right?
I'm and I'm from Texas. I'm a senior in high school.
Okay, your audio became very robot-y. I don't know.
I'm gonna turn the fan off.
All right.
I'm Cassandra. I'm a senior from Texas.
Okay, nice to meet you. Who do we have? Hadil, am I saying your name right?
Yep, you're saying it right. So hi everyone, it's nice to see you guys. So my name is Hadil, obviously, and I'm a senior in a school in New York State. It's sort of like a rural city I live in, not in like New York City or anything like that. And I'm attending this because I'm very interested in bioethics as well. I actually want to minor in bioethics and neuroscience. Like, those are my two minors that I'm really interested in. And I also want to be a child and adolescent psychiatrist. So I'm really interested in things of that nature of ethics, and especially with the field of psychiatry. There's that like different conversations of what's ethical and what's not, especially I was looking into and I was finding all these things. So like I'm really interested in learning more and having these discussions, even though I don't know too much. Like some of you have said, like I just want to learn. So I'm looking forward to it.
That's awesome. Thank you so much for that introduction. I'm majoring in neuroscience in university. I'm a first-year student. So I'd love to talk to you about that if you'd like. But thank you for that introduction. That was awesome. Nice to meet you. Ashley, do you want to go next? Oh, you're on mute.
Hi, my name is Ashley. I'm from Puerto Rico. I recently graduated from my bachelor degree. My first language is Spanish, so if you don't understand me, please be
Yeah.
Hi.
Yeah, I can hear you.
Okay. Where I am really interested in the neuroethics team because I don't know really a lot about it. So I'm here to learn more.
That's awesome. Yo hablo español.
Yeah, my first language is Spanish, Ashley.
Yeah, that's cool. I'm learning Spanish. Hopefully I'll be fluent one day. But thank you for the introduction, actually. Okay, Denise.
Hi, right here. So my name is Denise. I am a senior at Rutgers University in New Jersey. I am on the pre-med track, which is why I was interested. I just learned about this event this morning, so
Oh, cool.
thank you for hosting it.
No problem. I love debating, and I'm super opinionated, and I just wanted to bring a bunch of other opinionated people together so we can debate. Awesome. Thank you so much for those wonderful introductions. I'm so excited to meet you. It's so nice to see people from all over the place. We're going to have a diverse perspective in this room. Okay, so I just want to open the floor by asking you guys, what are your thoughts on the idea that when a patient is neurocompromised, say they have a tumor in their frontal lobe, for example, their judgment is obviously impaired. So given that context, how ethical is it to depend on the patient to make informed decisions about their healthcare plan? I just want to open that up. Anybody can feel free to chime in and give your opinion.
I think if it's obvious that they aren't making decisions as they normally would, then you should probably try to ask any immediate family or like whoever they're closely related to. Or if not, then it's up to the doctor probably.
Yeah. Anyone else?
Yeah, how often does it happen that there's no one to make a decision on their behalf? I'm just curious, do you know?
Normally, as far as I've read or learned about, I don't think it's like ethical in the medical field to have somebody else make a decision for you. So most of the time, obviously, when there's family around, they'll influence your decision, but it's your decision at the end of the day, especially if you're not a minor. Say, for example, if you want to go through with a surgery or not, a life-threatening surgery, it's the patient's choice if they want to go through the surgery and take the risk of losing their life or making it and becoming healthy, or, just unfortunately, just letting the tumor grow or whatever, not undergoing the surgery. So, yeah, it's very difficult to try and understand, what the right way is. So, tell me about what you guys think, what could go wrong in letting a patient who is neurocompromised make decisions about their medical plan.
I don't think they're in the right state of mind to even be able to comprehend with the situation and the intensity of what's happening. So I mean, I see both sides that maybe there should be immediate family, but then I also see how it might be unethical. But at the end of the day, I feel I mean, it depends on how severe the situation is, but I feel there should have been meetings ahead of time. Maybe I know sometimes out of the blue, you find things out too late, but I wish maybe there was a way you can make a patient plan or sit down with patients and try to talk about things before they happen, so you have a general overview of, okay, what things are the patients comfortable with if this happens, if they are not able to give consent, what things, what would you be fine with us doing and going ahead and doing, or waiting, or are you fine with a family member taking over and giving the doctors permission to perform things on you if you are unable to speak for yourself? I feel there should be a lot of thinking about these things before they happen, because once it does, there's not much to do, and the time's running out, and at that time you're really worried about the patient and their health, and sometimes things about how ethical it isn't really coming up.
Yeah, absolutely. That's 100% true. Anybody else have any thoughts?
I was thinking it would be a given that the doctor would just make the best choice for the patient, you know, to save their life. Because I thought life was prioritized above everything unless the patient can say something otherwise. So is it fair to assume that we can just trust the doctors every time? What do you think?
I remember even just taking like a CPR course, how we're not allowed to do it if like they don't want us to give them CPR and save their life. Because I mean, I know it seems like wrong because like, I mean, I agree, like your first thought would be like, I should save this person. But like, it's at the end of the day, it's always their choice ethically.
Right. Yeah. Like you were saying, Crystal, there's this unwritten agreement between patients or patients to be and doctors that, you know, whatever doctors, that's totally fine, Cassandra. Thank you for being here.
Of course, thank you for hosting this.
Yeah, no problem. So yeah, as I was saying, there's this unwritten agreement between doctors and patients that whatever doctors say is typically considered the better decision or the more educated decision. Yes, obviously they have so many years of training and so many years of knowledge, but at the end of the day, it is the patient's choice if they want to, for example, undergo a risky surgery with like a 90 or like a 10% chance of survival, or live out the rest of their life with having that disability. But let me ask you this. Is it morally right to allow a family member to make medical decisions for a patient in case that the patient is absolutely disabled from making an informed decision?
I think we can only do that if the patient is, like, if they previously stated that they're okay with it, because, you know, a lot of people have like different situations at home and they might not be comfortable with just anyone deciding, whether it's their parent or someone who we would assume to be close to them.
Yes, I agree. Like blood isn't everything. Some people, you know, maybe have friends that they feel a family to them and their actual family. Maybe they've never met, or like they're not even close to them, or maybe their family doesn't even like them, you know? So there's like different situations. So I sort of agree with like, maybe it should just be like, it doesn't have to be family. It could be someone that they're really close to, maybe a significant other or someone they trust, or, you know, something like that. But also with like the doctor and, you know, them deciding, you're always told to have like second, third opinions. So you can't always trust that the doctor in the, you know, that room who's going to perform the surgery or whatever is going to make the best decision for you. Just doctors have gone through all that training and you expect them to be the most knowledgeable. You can't always, you know, expect that. There's still issues in any field that there's, you know, a few whom, you know, accidentally or purposely don't know the right decision to make.
Yeah.
Yeah, I think a lot of that also depends on culture, and that's why we need a diverse set of practitioners, honestly, to be respectful of the different cultures and stuff. Because maybe the American culture says save them no matter what, but there's such an array of different choices and desires that people want. And so I hope that people can respect that. And also, I think we just need everyone to write down their wishes right now. So maybe we can't help the people who didn't state it yet, but I think also if we get everyone to just like mass sign those papers, it might be a lot easier. What do you think about that?
I think that it will be morally right if the patient leave a consent.
Yeah. Yeah, absolutely. So when we think about, for example, I remember reading about this incident that happened in India where because of COVID and all the chaos that's going around in the medical community, there was a older man who was on the ventilator for a while, and he had a very low chance of survival, but he did have a chance of survival. what doctors decided to do was take him off the ventilator without permission of the patient or the patient's family, because in their opinion, it was ethical to provide that life support to somebody who had a greater chance of survival versus somebody who had a lower chance of survival. What do you think about that? Is that ethical?
Oh, you can go ahead.
Oh, you can go, it's fine.
When Crystal mentioned it earlier, I was actually going to bring up the, like, in India, the ethical, like, and consent standpoints are, like, very different. And usually, like, doctors, I don't know if it's legal or not, but, like, family can pretty much always make decisions for you because that's just, like, the norm there. And so I think it is wrong, but I feel like, I don't know if it has action been taken, because the legal system in India, usually they try not to, like, attack doctors.
Right, yeah. So since you guys are from different places, tell me about what the medical system is like in your countries or where you live.
Well, at least in Puerto Rico, the patient have the right to take decisions, or the family, if they have the consent of the patient.
Right, yeah.
I'm not really sure about the consent part, but in terms of the healthcare system in Taiwan, wow, it is the best that I've ever known, honestly. They have national health insurance, and it's really easy to go to the doctor anytime you need to. And it's the first time in my life that I've actually had health insurance, and I grew up in the US. I should say I had health insurance when I was younger, but like in terms of just being an adult. And I'm not trying to say anything bad. I'm just trying to say, like, I fell through the cracks. And I feel so secure now, like in the health system, knowing that I can get any checkup I need whenever, and I can keep up with my health. So I really wish that the insurance companies and insurance policies would be easier in my home country. I'm not trying to say anything bad, but it's the reality of it, is a lot of people are uninsured. And so I feel really happy to have learned this system. And then I hope when I come back to the US, I can do something. I don't know how, I have a lot to learn, but just to make it easier for people to feel that they are entitled to a healthy life. So that's all I have to say. Just a little plus for Taiwan, because I think it's great.
That's amazing, and I completely agree. And I can safely say that we all agree that that should be something readily available in all countries, for that matter. So let us think about when, in times of panic, say somebody got in an accident and they had severe head trauma. In that case, the patient is considerably disabled, and family members are also panicked. In that case, what is the ethical decision to make in terms of discussing consent? Who has the upper hand, or how do we level the playing field for that example? We're considering the doctor-patient conversation here. So we're talking about in the case that family is also panicked and they're basically unable to make an informed decision in a calm state. What is like the ethical approach to making sure that the best decision is being made? Not that it's one side and it's the doctor's opinion.
I mean, I'm not sure. Legally, the doctor would be liable in this situation, right? So I feel like ethically it would be okay for the doctor to make the decision, but I don't know if they're allowed to, like, considering.
Anyone else?
This sounds kind of strange, but I wonder if you just like isolate the person and put them in a room and try your best to break it down in the most simple terms possible and see if you can get a direction one way and really make sure they have no pressure by making that an isolated room, make sure they have enough time to think about it or something. I mean, there's going to be different levels to how compromised they are, but I wonder if that would help at least to make their own decision that's not influenced by family, because I think that would be the most accurate. What do you guys think?
I like that idea, like explaining it so they understand, because a lot of times the error comes in when like either like the doctor doesn't explain in simple enough terms for the patient to understand, and then they expect them to like, you know, make an informed decision. How will they do that if they don't really understand, you know, the gravity of what's happening? You can't just use big words or, you know, a lot of doctors are afraid of using the word dying, or, and I know there's necessary ways of saying it, but you have to make sure you say like how severe it is so they know like how long will they have left if, you know, it goes either way. And I also believe that maybe there should be a system put in place where like a patient has a trusted doctor beforehand, like they have like a person to go to, whether that be like, it can maybe be more than one, or just, you know, one, like a medical you know, maybe like a doctor or something like that like they trust, and they have sat down and went through like, you know, what they what sort of like invasive surgeries are like they're okay with having done on them, or, you know, what they believe what should be done at certain times, like depending on the severity of the situation. And then like the doctor, whoever doctor is performing on them or is with them at that time, or nurse, whoever it is, they call up that doctor, that medical professional, and they speak to them. And then that person can make the decision on their behalf if they're unable to. Or maybe they can be like a backup person as well, just in case, like, you know, that person isn't able to speak. But I feel like there should always be like ahead of time some like a patient chooses someone to like make a decision for them if they're not able to.
Definitely. That's a completely valid opinion. Does anyone else have any comments?
I think that if the patient or the family are not able to make a decision, well, the doctor can make it.
I was just thinking that for homeless people, that's the only way to go. It's just whatever the doctor says, and there's probably going to be some sad cases where the doctors are trying an experiment, you know. Let's hope that doesn't happen, but you know, I think for the most part we can trust that the doctors will try to make the best of it. And so for the homeless people, I think it's perfectly fine to have the doctor make the decision. What do you guys think about homeless people?
I don't want to sound too negative, but like I feel like even the systems that are being like proposed in our discussion, like they sound great, but I feel like if we actually implement them, that'd be like difficult for everybody to be able to choose someone, or everyone, like how Crystal was mentioning the homeless people, like there are always going to be like outliers. And I think the reason we don't have systems like that is hopefully because they don't want injustice for those people who might lose their lives because of a wrong call that a doctor made.
Right. And so I agree. Like, I think maybe what we had to start with is like informing the doctors about these things. I feel like there should be, I know I feel like a lot of medical schools are already doing this, but like there should be ethics curriculum heavily like practice and like taught to the students. And not just that, but while they're a doctor, there should be, you know, monthly or yearly like materials and conventions, and maybe like a certain amount of hours that they have to do just learning about like different like ethical guidelines and things, like how to handle situations such as that, and making sure that like, you know, every doctor is there to help the patient, is going to make the right decision for them, and, you know, hopefully nothing, you know, isn't going to do, you know, what's bad, because you never know, some doctors nowadays. But yeah, I feel like it should start with like informing the doctor. Informing the patient is great, but like you have to inform the doctor and how to inform the patient. So if you don't start with them, then so everything else sort of, you know, doesn't work.
Completely true. Yes, that's very important because ethics doesn't have any right or wrong answer. Every situation isn't very black and white, so it's difficult for doctors in situations like that to make a very solid or clear decision. And given that, yes, ethical training is very important because that will basically prime these professionals' minds to think in a way where they're making decisions for the greater good. So when it comes to informed consent and neurocompromised patients, the idea is that the brain is the organ that is being treated and the organ that is also providing consent. So given that, I guess, paradox, is it ethical for a doctor to treat the patient because they're obligated to the betterment of their patient's health? Or do you think, is there a way that doctors should basically mitigate any immediate problems to help the patient make that informed decision even in their disabled state, if that makes any sense? Is there a way essentially to level the field so that the patient, for example, a patient has Alzheimer's and it's a consistent debilitating situation. So given that a patient has Alzheimer's, is it ethical for the doctor to keep stuffing information into their head and pushing them to make a decision? Or is there any immediate steps that can be taken to essentially allow the patient to make a decision? Or should the doctor just go ahead and proceed with whatever treatment they have in mind?
I think in situations like that, I'm pretty sure, isn't the doctor, they're not allowed to do like at least life-changing things, right? Like, correct me if I'm wrong.
Right.
So I do know that a lot of doctors try to do whatever they can without like they don't fudge the legal system part, but they might try to do like, give them like an extra medication or something to make it easier for the patient without overstepping their like legal boundaries.
And since you brought up the legal, sorry, Crystal, did you want to say something? You can go ahead and say that. Okay. I just don't want to get this off topic and not allow you to say what you wanted to say. So you can go ahead and say what you want.
Okay, but I did want to hear about the legal stuff too. So I was thinking that you should definitely give the patient time. So let them, maybe if it's possible that it's not life-threatening within like 2 days, definitely let them go home and think about it. I think any decision, no matter how big or small, maybe you could think about it for a night. So don't pressure them to make a decision right away, but I think at least the time would help a little bit, because I remember like with my own grandma, like she did have Alzheimer's too, but she was definitely still there. Like she did make a decision that I didn't agree with, but she also had depression at the same time, which I think is an issue too. So then I think if we could focus on patients' depression, if they select that they would prefer to die, I know that's a little bit like, I don't know if we have those kind of like resources, but I do think that depression was a huge thing, and like I kind of really wish she didn't make that decision. But that's my personal story. But so on a large scale, though, I do think depression in the elderly is a big issue. Younger people, I think too. I think if they would select to not have any care, we should first have some therapy with them and then see if that's their real decision. Because if it really is, after like a year of therapy, then we'll say, okay, but at least we can say we tried for a little bit. What do you guys think?
I think that it's true. The stage of the condition, other conditions can influence in that decision. So
Yeah, I'm sorry to hear that, Crystal, but yeah, my grandfather is showing, I think, some beginning signs of dementia, but he's also still there. But yeah, I feel like that is ethically, I think it is right. Like it's something that we can assume if the doctor's a good person can happen. But again, I think it just doesn't happen because there's always going to be someone who might like blame the doctor for anything that might happen, and then they will have to like go through those processes.
Yeah, Crystal, I'm so sorry, and Shreya as well. Um, since you guys bring that up, this is a very interesting topic, which also goes very well with what I was about to say with the legal system. Are medical professionals basically obligated to take steps to treat a disease or disorder that currently shows no symptoms or shows very mild symptoms that potentially may or may never materialize in the future? What is the right time to intervene? Because ethically, you'd say if the doctor has a solution that can cure or prevent something from escalating, it's in everybody's best interest to allow for that to happen. But there's also the legal system that comes in there and prevents that from happening, and this whole informed consent thing comes to place. So my question is, when is the right time to intervene, and how do you think the legalities come into play here?
May I say something? Can you
Yeah,
guys hear me?
absolutely.
Awesome. Well, in terms of like, usually I guess there's like that the whole legality part of it because of the like potential risks for all of these like I guess procedures you could call them. But in terms of like intervening, I guess it really depends. Like it really depends on the details of the situation. Like every patient is completely different. Like there's so many factors that can contribute. But like it's easy to say like, oh, if the chances are like really high up there of like it going out like the positive way, it would be like, oh yeah, go for it. But then there's like you gotta really like think about the risks and the like doctors obviously don't want to get into any legal issues or have anything go wrong with it, and like say like every doctor's intentions, sorry, I don't know if it's cutting off a little bit, but every doctor's intention is obviously to better the patient, but they also have to be concerned about like themselves and like their practice and like getting into trouble, and that's like, I don't know, there's just like so much to consider when making those type of decisions.
Absolutely. Anyone else have any comments? Shreya, go ahead.
My only thing would be like, yeah, what Denise said about like we can't just like the doctor has those legal things, and those legal things are obviously in place because, I mean, I know the doctors in India, like a lot of people, there's a lot of corruption in some systems there. Like not everyone, obviously, but there are some people who do like they would do something that isn't in the best interest of the patient, and so that's why like we need to have those measures in place, even if like it goes against our basic ethics.
Yeah, I think it gets interesting when you start thinking about cost too, because especially for homeless people, I'm not saying this is my opinion, but a lot of people may think, okay, well, I don't want to spend the resources on someone who we don't know what their decision is. So it's easier for me just to let them pass away, maybe. So that's really unfortunate. And I think that, yeah, somebody also should be there to kind of judge what is fair and not fair, because sometimes where they would put the money is not even the best use, so there's no excuse in denying them those funds. Although I can't explain that too much more, but when you think about cost, a lot of people might choose not to do the procedure and on like a delicate decision.
That's true. It's actually disheartening to see how many external factors that are completely unrelated to medicine play into the decision of treating someone and helping them and not, on the other hand. Cost is definitely a big thing. We can see that now with the pandemic, how there are so many patients who are, doctors are just unable to treat them because the whole triage thing comes into place where they need to maximize their chances of helping people survive. And in doing that, they don't have unlimited resources, which is sad because the whole point of healthcare is to try and help everybody. The whole point of medicine and these amazing developments in technology and surgical techniques is so that everybody's life can be saved. But when factors such as cost and legalities, all of these come into play, it's very difficult for medical professionals to make choices that will make everyone happy. That being said, I wanted to bring in the idea, for example, of deafness or the inability to speak, being mute. Those are also neurological conditions. Given that, is it ethical for scientists or neuroscientists to develop cures for those disabilities, for deafness and for muteness, for example, or for blindness for that matter? Does that lead to censorship of centuries of literature, perspectives, poetry? How does that affect it? Because honestly, you think that a person who's born deaf is disabled, but we only consider that as a disability because we compare them to somebody who's fully functional. So my question is it ethical to develop cures and try to, approach this thing as you're treating a disability instead of, identifying someone who's deaf as a fully healthy person, for example?
I don't think there's anything wrong with calling a disability. It just means that, you were born without something, but that's okay. Everyone is born different. Maybe you don't, maybe, you're deaf, or you're mute, but then your other symptoms are heightened. So that's pretty cool. It's kind of like a special, a special, superhero power, So I don't think there's anything, wrong with that. But with finding cures for it, I also don't think there's anything wrong with that either. I know some doctors are already trying to do that. Like they go to, I know I've seen videos of them going to different countries and those kids who are in third world countries who wouldn't be able to afford the surgeries or whatnot. They cure their blindness or whatever, and it was really cool seeing how the family reacted and everyone was happy with it. So for them, if it makes you happy, then at the end of the day, you should find cures for these disabilities, and at the end of the day, whoever wants it can get it, and whoever doesn't want to doesn't have to. I think as long as we had the decision, then those who want to do it have it at least. We don't have to force anyone to cure something if they don't want it to be cured, but it won't make them any less of a human. I just feel like if they decide, let's say there's a way to cure all blindness or to cure all people who are deaf, we should, if people don't choose to do that, we should still be trying to make it so resources are available to them, music, art, literature, learning about this the medical field, things like that, important things that you should know as any person, as any human being. Those resources should still be translated or, made accessible to those people, if they so decide to, not have those, cured, which when I mean cured is not a bad thing, you need to be cured, but as in to assist them maybe to live a more fulfilling life. But some people, feel their life is already fulfilled without having to go to those lengths.
Very true. Anybody else have any comments? So following up with this discussion, I want to ask you if it's ethical to essentially pre-treat for diseases or disorders, neurological disorders for that matter. What I'm saying is, for example, is it right to genetically alter babies, for example, before they are born to prevent them from getting neurological disorders. For example, deafness or muteness. Is it ethical to change their genetics before they're born to prevent those disorders from happening to them? Or is it also ethical to, like, once the baby's born, to treat them before they grow up so they don't have that disability? Is it ethical in the sense that, are we taking away certain experiences and certain modes of expression? Are we censoring those experiences for someone without their consent because they're either unborn or they aren't in, consent giving ability? Anyone have any thoughts?
I can say something. Sorry, I had to step outside to turn off the camera for a second. But I think that not for like basic senses, like being deaf or blind, but definitely for some disorders, I think that we should genetically try to prevent that from happening, because I think it is getting closer and closer to being really possible. Now, I think it's a slippery slope, because then people all of a sudden want to make, their children into whatever they desire, with exterior qualities. And I think that should not be allowed at all through genetic manipulation. But yeah, I think that if we could prevent a baby from having something serious and life-altering, I mean, being blind is not terribly life-altering. I mean, like you're saying, it's a positive thing, actually. So not that, but more serious things. What do you guys think?
Yeah, I feel like this could overlap a lot with how someone stands on like a pro-choice, pro-life thing. Because if you think like it's not, like the baby doesn't need consent because it's not alive yet, then you might think it's okay. And then if you don't, then you might not. So I think you definitely need to get like the permission of the family members. And I agree with Crystal. I think it would be a bit extreme if you start like customizing babies. But if the parent wants to solve a disability or issue that they might have, then
So those are very, very interesting points. Thinking about it from that perspective, under the legal system, if you're a minor that is under the age of 18, I'm talking about in the context of the United States. If you're under the age of 18, you have, I guess, minimal say in your healthcare plan or in your healthcare plan. So given that, is it fair that this system is in place? Why do we suddenly consider that an 18-year-old will suddenly have the ability to make informed decisions about themselves that a 17-year-old cannot? And for that matter, why can't a 13-year-old choose what they want to do?
It's interesting that 16 and a half years old, at least in the United States, we're able to like technically drive. There's a six months waiting period. You can get your permit at 16, and then 6 months later you could start, drive. You're able to make those decisions, like especially, there's impaired drivers and, driving, it can be dangerous, but, we give 16 and a half year olds, an ability to do, make those kind of decisions. But we don't give them the decision to vote. We don't give them the decision to, make life there. Even I can go as far as life threatening decisions, or even small ones, but they can consider them invasive. So I find that really interesting that, we give them certain things, only give them certain limitations, and we're basically telling them, no, you are not intelligent enough to make these decisions when at that age, you are, I feel. Obviously, we're always developing, but even at 18, you're still going to be developing. You're not 100%, developed. So you're still, who you are at 18 is going to change when you're 21. It's going to change, at age 30. So yeah, I find it really, strange that 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 occurs, and parents sometimes don't really understand the extent of how a minor might feel. Obviously, if they're like a really younger kid, maybe then the doctor could see, okay, let's see how much this child or this teenager or whatnot, let's see how much they understand the situation, and let's see if I can try explaining it to them. If not, then okay, maybe we could have the parents decide for them. But I feel a lot of teenagers, especially 17, 16, 15, they are able to express themselves, are able to understand what's being told to them. So yeah, I think they should be the ones, unless I mean, I keep saying the doctor, but in a lot of these decisions, the doctor is usually the one who's in charge of it. I mean, I don't necessarily agree with it, but at the end of the day, we're doing the best that we can. So yeah, I think the doctor could sort of, make that decision, and if not, maybe another medical professional can, if maybe the child does not, or the minor does not believe that the doctor is making the best decisions. I feel like there should always be a way for a patient to get, a second opinion in the room, or, just in case, they feel they're sort of just stacked against them.
Yeah, it's very interesting that you bring up the driving aspect of it. It's ironic to think that you would trust a 16-year-old to drive a car, which requires a lot of maturity and a lot of developed ability to judge situations. Given that, if they're allowed to drive a car among like adults and all kinds of drivers, how are they not capable of making decisions about their own health? They are risking their own safety on the road. How are they not, liable for their own health decisions? It's very important to think about that, because it's just 18 is such an important age. Suddenly you can vote. Suddenly you can make full, 100% decision on your healthcare plan. And it's funny to think that there'd be such a huge development between the age of 17 and the age of 18. So what do all of you have to say about that?
Oh, I think that like the age of 18, I don't know if there's anything special about it, but like I think we just kind of picked it and we just stuck with it. Like I don't think there's any major maturity difference at that age or anything, honestly. But when you get to like younger ages, of course, like a 10-year-old might not want to, they might not make the right decision because they might think of like the pain of a surgery or something, and not the actual like effects of what it have on your life, because they won't understand that completely. But yeah, I think it is kind of crazy how like as soon as we turn 18, there's no like staggered entry. It's just like you're an adult now. You have to do everything.
Yeah, I agree with you. And like it's crazy because at 18 we're throwing all of these different, rights. You can vote, you can, now you can make decisions for yourself. I think it's doing more harm than good, because now at 18, also like 18 you can make your own. There's so many like lists, I don't really know all of it, but like that's not good, because now at 18 we're like, oh my god, we can do all these things now, and sometimes people go overboard. Maybe at 18 they can make decisions for themselves. They may not make the best one. I think maybe at 16 you would be even better than 18, just because at 16 you're not given all those different rights and responsibilities. I think it should be a gradual thing. Like you should be given slowly but surely. You should be given more and more rights as a citizen, more and more rights as being able to make decisions for yourself. At 18 is just like too much, I feel like. That's why people like go, like I said, go overboard. Even 21 they go overboard. I could drink legally. So I don't think that's right.
Yeah, I feel like we can't even, as a country, like not all of us can even agree on like human rights. So for all of us like at 18 to just collectively be like thrown into the world and do what we want, everyone's gonna like not everyone's gonna make the right decisions.
Right, and as the world advances, there's changes all the time. Why can't that age of consent change as well? There's so many, I'm pretty sure a lot of different regulations also have been changed, but you know, age, where fundamentally there's a science behind it. I'm pretty sure people can see at 16 you're still able to make decisions. They know there can be experiments. I mean, look at all the change, you know, so some of us are doing. We're, you know, teenagers, we're having these, you know, discussions, and, you know, we're not 18, there was an age limit for this discussion. It's for everyone, you know, no matter how young or old. So we're able to make these decisions about, you know, ethics. That's a very important topic. So why can't we make decisions for ourselves? And why can't minors do that as well?
Absolutely. Anyone else have any thoughts? This is a very interesting discussion. I'm absolutely enjoying it. Anybody else have any thoughts? Just about the 8%.
Yeah, I think 15 would be okay to consent, because I think any younger than that, you still really are developing. And a lot of kids have anger, you know, and just emotions all over the place. So maybe even younger than that, because I guess when the hormones hit, it's kind of like that's kind of impairing your decision. So I wonder 12 might be okay. What do you guys think? Is that too young or what?
I feel like everyone develops differently, and I don't think you can like really put an age to it. I feel like someone at 12 might be more responsible than someone at 18, depending on that person. I feel like everyone like really develops, like this. Everyone has different social maturities, and so I feel like there should be a way for doctors or whatever to be able to, you know, speak to someone and see if they are actually mature enough, because yeah, like I said, like I think everyone's, you know, sort of different. Yeah, you can, yeah, I'm just repeating myself, but like you can't really put an age to it per se.
Yeah, maybe we could do like in the article he mentioned like those cognitive tests. I think it was like, I don't know, it's like something with cat T, something like that.
Right.
But like, yeah, like there might be like a test or something we could do to like see if they could make their decisions for themselves.
Yeah, there's actually, right in that article, they talked about a research that's being conducted, or multiple research that's being conducted about the signs of decision making. They're trying to study what parts of the brain are activated when it comes to decision making. And they're trying to separate like the normal brain from a decision making brain. So essentially they're trying to identify a new neural network that is solely responsible for decision making, especially when it comes to providing consent. Given that being said, do you think that decision making is so tangible? Is decision making simply a connection of neurons, or is it a more abstract concept?
I think even if we do establish like which pathways lead to us making decisions, like where our brain thinks, like all of us think differently, and so like therefore like the only thing I feel like the most tangible thing that you could tell from figuring out those pathways is just if they're impaired or not. I don't think you could establish whether they're making good decisions or not just with like finding out where we make decisions.
I also argue that it's kind of a combination, because if you think about it, decision making is really a series of answering yes or no questions, and neurons essentially can either fire or not fire. But I feel like there's also a component of not everyone is going to answer yes or no to the same question. So I think that's not necessarily scientifically related.
True, true. That's very true. Anyone else have any thoughts?
So I was looking online, and when you guys are talking, I was looking up if I can find a way of like, look over like the consent rules on consent. So I was looking at like the Medical Protection Society, and it's interesting. There's a category that said age incapacity, and a lot of this you see it is up to the doctor. It's up to the doctor. If, you know, like let's say something happens to the patient, it's usually up to the doctor. And under age incapacity, it said it is up to the doctor to decide whether the child has the maturity and intelligence to fully understand the nature of the treatment, the options, the risks involved and the benefits. When the child is such maturity and intelligence, he/she would have the legal capacity to give consent to treatment. So I think it's really interesting, like the doctors somehow know if they're, have that, intelligence and maturity. So I'm interested in seeing like how they just do that. Do they just have a quick conversation? Because depending on the, what's happening, it has to be a quick one. So how are you able to figure out like how, intelligent or mature the patient is? So yeah, I'm curious to see like in the future if there's going to be better ways of finding that, like, the questionnaires. But I think it just depends on like the situation, if there's quicker ways, or sometimes a quicker way isn't the best way. So yeah.
Thank you so much for sharing that. That was actually very interesting to learn about. I want to keep this conversation going because I think that we're bringing up a lot of new ideas. Anybody else have any thoughts about the age of informed consent or the neurological research that's going on behind the brain of decision making? Okay, so let's move on to another idea. Since we have discussed a lot about, we talked about the idea of, what's more ethical when it comes to informed consent and neurocompromised patients. We also talked about the imbalance of power between doctors and patients. We talked about the age of informed consent. We also talked about the research going on behind it. So after after listening to all of these perspectives, I want to hear what's the solution, what's the approach to making this system more, I guess, equitable for everybody, both the patient and the doctor. What are various approaches that can be taken to make these decisions more ethical, make these outcomes of, medical interaction to be more moral and more accepting of various cultures and perspectives? I want to hear what you have to say.
I think, sorry to keep like talking about other people to speak to, but
Totally fine.
but I think that before any of this happens, because out of the blue something just can happen. It can be, really hard to deal with both for the patient and the doctor. I think like what I said before, have the doctor attend, being constantly informed of different research and different things like that. I know if you're board certified, you have to keep up with things like that, but I'm not sure like for generally like how much training they constantly need. Like teachers, they constantly have to, go to training workshops and things like that. I wonder if doctors are held up to that same standard. I'm hoping, but I know like, they have to go to like, medical school and residency. And so they might think, oh, they're knowledgeable enough, but things changes, even through those years of going through that. And the other thing would actually be with patient. The patient should have, things explained more simply to them. I feel like, if you look up I know the website, like, the internet is not always to trust, and, doctors, of course, are supposed to be the most knowledgeable, but I think that they should be constantly informed about different diseases. They should all like communities should have the information available to them, like starting at a young age. It should be taught at schools. Even adults should be, receiving information online. It's readily available. It's easily explained. A lot of times they use all these fancy words, and it's, all these different things in the medical field are explained in a way that like people are turned off by it, and they do not want to explore more about their health because, they're like, oh, let me just, that's their job. It's a doctor's job. But in the end of the day, it's the patient's job. Whatever guidance the doctor gives, it's up to you if you go with it or not. And I feel like it should stay that way. So if there was a way, at a young age to make people more interested in the field and more interested about their rights, as a patient, then it would be better off for everyone else, because then you'd know, okay, what am I most comfortable with? There should be, like I said, like before, like a set plan. So when it comes to that, everyone will be informed, everyone will make the best decision. And even if, time changes and maybe you're not the same person you were, it can be constantly updated as long as they have at least something to go by instead of nothing, and they're rushing, the doctor's rushing to make a decision that, might not make all parties happy.
Absolutely. You bring up a very interesting point. It's not fair to just have doctors only be the ones who are getting trained and having all of this new information stuffed at them. Do you think that it's also important for, I guess, schools or biology classes, for that example, or PE classes, to include in their curriculum topics about patient rights and informed consent, and what skills or what ways of thinking is required for making informed decisions about your healthcare plan? What do you guys think about that?
Yeah, we're like constantly told, in elementary school, starting from elementary school, our Constitution, our rights, the universal human rights, or whatever it's called. We're constantly at a young age, I remember hearing about it, like you have the freedom to, say what you want to say, and under certain limits. But why can't that be applied to the medical field? Why aren't we learned about what that means? Because when I think of rights, I think it's a broad spectrum. It's not just about things, right to vote. We hear those all the time. We should be hearing about different. We should be focusing on different aspects as well, and not just that.
I also think it's really essential, not even just for neuroethics, but just in general for students to learn their rights in healthcare. Recently, my sister didn't even know that she was scared to talk to her own therapist because she didn't know about HIPAA laws. So I think it's really essential that everyone learns those so that they know how to defend themselves in the medical field, because at one time in our lives, everyone is going to have to go through that process.
Yeah, in terms of educating people, I also think that we should have some workshops around the country. Even if you can't get it so quickly integrated into curriculum, you can at least have workshops right away and invite people to come and let them know their rights. And then also make it available on the doctor's end to make those choices in their computer systems or whatever. And then also I think we should teach doctors on how to simplify things for people, because a lot of times I think they just can't understand it totally. And I think it is a skill to learn how to be a teacher and to explain things very simply, because that's going to be the best way to get through to the people, because I do believe there are lots of situations where the people can make their own decisions. So I think time, and then also making sure to refresh, that they understand, and coming at it from different ways, teaching from different methods, just to make sure that they understand. And then when it really seems like they can, and hopefully time is not of the essence, then I think that would be the best way to move the ethical decisions forwards.
Any more thoughts? I want to hear from those who haven't spoken in a while. What is your opinion on providing education and training to students about their patient rights, and to medical professionals about, where the boundaries are culturally or just ethically?
I think it's a good idea to do that, especially what Crystal said about it being a skill to be a teacher. Like how people tend to go happy highlighter, like you need to know what you can leave out and still teach people the full extent of what they're trying to get into.
That's very true. We're about to wrap up soon, but so the last question I want to ask you guys is, what about cultural training? When it comes to making informed consent, a lot of the times culture, traditions, religion come in the way. how can we make that conversation easier for doctors and patients?
I'm not entirely sure with what courses specifically that med students have to take, but I think one step would maybe be a cultural class required in medical school all throughout their years so that they have an understanding and empathy for people who are struggling to align medical and religious or cultural.
Absolutely. And just, you know, I personally believe that experience is the best teacher. And so I think medical professionals should be trained to ease those conversations between a patient and themselves, and, you know, allow for the patient to explain why they're uncomfortable with proceeding with the treatment. And, you know, like you mentioned, Hope, empathy is such an important part of every doctor-patient relationship. It's super important for the medical professional, or the doctor in this case, to be empathetic towards their patients' backgrounds, to their perspectives. It obviously, in most cases, religion or culture can drive people to medically, I guess, misinformed decisions. But it's the doctor's responsibility, if they believe that a certain treatment will help them become better. It's important for them to empathize and, you know, build a conversation with their patients, and you know, at the end of the day, help them make the best decision for themselves, because that is the sole purpose of healthcare workers. Any last thoughts?
Yeah, I also think diversifying the physician or even healthcare industry is really important too, because then you find a lot of times that people are really open to other points of view and they don't try to force their way. I know a lot of people think, not just for in the medical field, but around the world, my way is the best way. You know, in fact, that's what happened with colonialism, if we even go that far, but I certainly don't agree with that. I think that people should be left to their own decisions in the end, and so it's not easy to do that when you have zero exposure to other cultures. So I think diversifying the workforce is a really huge way forwards. And a lot of times it's easy to overlook people because maybe their situations were difficult, and so maybe they don't have the best grades, but I still think that we should work on giving people the opportunity who really want to, when have gone through a lot, so that we can continue to diversify at least the physician workforce, because right now it's getting more and more diverse, but I don't think it's really where it needs to be in terms of making the best decisions for the American people at all times.
And for people all across the world. Yeah, any final thoughts? I want to hear from you guys. Any last things you have to say? Anything you wanted to say earlier but didn't get a chance to? Any opinions you guys want to share?
Yeah, I think that understand the cultural differences is really important to understand and respect every culture, offer a good treatment for the patients.
Yeah, absolutely. Cultural understanding, empathy, education, experience, and diversifying the field, they're all absolutely viable solutions. And we need to get on it. Honestly, we just need to get on it. This is a very obvious solution, and it's completely necessary to start working on it. So, guys, this was such an amazing conversation. I am so lucky to have gotten the chance to have this conversation with all of you. You've all provided such amazing perspectives. And wow, I hope I speak on behalf of all of us when I say that this has been such an incredible learning experience. And I hope that you guys really enjoyed this, and I want to thank you all for coming. I'm going to stop the recording now so I can give you guys some announcements just before we are ready to dismiss. So give me 1 second.
It's really helpful.
Awesome. Anyone else have anything to share?
Thanks for giving us this experience, I guess.
I'm glad you guys enjoyed it. Yeah, thank you so much for coming, and I hope you have an amazing rest of the day. Feel free to share about your experience on Instagram so others know what they missed out on. So feel free to share about this experience on Instagram and tag the Neuroscience Foundation if you want to be featured on our story. But thank you so much for attending, and I hope you have a nice rest of the day.
Thank you.
You too.
Bye, everyone.
Bye. Thank you.
Bye.